In this video, I'll walk you through how to use AMBOSS efficiently to create a smooth clinical workflow while on your second year rotations. The first thing you're going to do is you're going to start by gathering the essential background information that you need. So first and foremost, AMBOSS. On AMBOSS, if you search clerkship, there are different guides. There's a clerkship guide, and then for each clerkship, you can go through different details. So the top 10 topics in each clerkship or whatever rotation you're on, and you can go through that to get great background information. For example, how to write the progress note, what are the main topics. If you go into a note that's called Daily Life of an Intern, this will give you information on daily progress notes and how to write them in detail. As a second year medical student, we should have a strong knowledge of the H&P. So when you come into the internal medicine clerkship guide, you go under clinical skills H&P, and you can go over exactly what you should be doing and responsible for in terms of history and physical exam. For example, if you come into a cardiovascular examination, you can click on this, and you'll get much more detailed information on exactly what to conduct once you go into the patient's room. The same articles will also provide you information on how to approach the patient's assessment and plan. So with the example patient case that we gave, once you understand the background of chest pain, angina, the different differential diagnoses, what you can use is that you can actually use the AI feature. So basically you start from here, you go into AI mode, and you can ask it a question, or to help you write the note, you could basically say, hey, this is my patient presentation, create me a template. So here I asked for it to create a template for a SOAP note and a progress note. As you can see, this is the initial SOAP note template. And then I also asked for it to give me a daily progress note. So this is an alternative to going through a daily life of intern guide if you don't have that time. And as you know, as a medical student, it's all about having efficiency. As an additional step, if you wanted to work on using your current H&P information to create a potential assessment plan and just to brainstorm some ideas, if you're able to remove all the patient identifying information out of your note, you could simply put it into AI, to AMBOSS, and ask it, hey, based on this information, help me brainstorm a potential assessment and plan. Now this is beyond what would be expected at the level of a second year medical student, but just gives you an idea and helps you start to think forward as to how you can help integrate your future skills with your current knowledge. So let's take a look at what it gives us here. So here's the output it gave us. Just want to quickly go through this to understand how it came up with its differentials and assessment, and what kind of diagnostic plan is it giving. Does it make sense? Now the next two steps that I'm about to show you in your clinical workflow helps you relate your clinical knowledge back into your test taking, and this is where AMBOSS becomes a game changer. So you can ask it, provide me with 3 high-yield USMLE style clinical vignettes for patients presenting with different types of angina and or coronary artery disease-related problems. Here we have 3 different vignettes that's given us. The main thing you want to focus on is the presentation, as that will help you understand the way that they'll tie in a clinical presentation into a question on your step 1 exam. Vignette to unstable angina, and third one, Prince metal angina. So the last thing that you can use to tie this all in and your knowledge so that you can use the patient that you saw in clinic and never forget the concept that you learned is by doing questions. So you could say, based on these 3 topics, provide me with 5 question bank. Now here we have it. It's created us a question bank session with 5 high-yield questions relating to things that we just saw in our patient. And this workflow process is an all-in-one way of learning and tying in clinical knowledge and helping yourself become the best physician that you can be for both boards and while you're in clinic. And for those of you that like to do Anki, after doing these 5 questions, you could unlock cards related to these 5 questions and add them to your deck